And also on the show, separating fact from fiction when it comes to helping someone overcome an addiction to drugs or alcohol. You may be surprised to know which method has the best results for maintaining a sober life. We have all this and more today on Daytime. When you think about treatment for things like alcohol and drug abuse, you may have a preconceived notion about the process. I'm guessing much of that would be guided by movies and TV shows that portray a person going away for weeks on end. Well, that's hardly the reality. Here to shed some light on the process as well as ways to help the substance abuser, we have Ed O'Reilly with the Neil Kennedy Recovery Clinic. So welcome, Ed.
Good morning.
I always have thought the same thing that I just talked about, that people go away to rehab kind of for a long period of time. And is that celebrity kind of type, I guess, stereotype something that a lot of people think?
Well, I would think so. I mean, most people, fortunately, don't have a lot of contact with going to treatment, thank God, because they don't need to. But what hits the media and what hits the news is the high-profile stuff, and that is what the high-profile stuff seems to be. Most of the time, I call that going away for the cure. Okay? We'll send them away for the cure, get them back, and they'll be all fine and fixed. It's like sending somebody away, having your appendix taken out, and you're back and you're fine. And it does not work that way.
It certainly doesn't. I mean, the reality of this, much different than that. So bring us up to date on that.
Well, what happens is there is a relatively small percentage of people who do need, either because they have neglected looking at their addiction issues for a long time, and so they need to have a relatively high level of care, or people whose lifestyle is so dysfunctional. Like I had, for example, one time a young lady who was living with her heroin dealer.
Okay. Yeah.
That's not going to be an environment in which you can recover. So sometimes you do need to go into a protected environment for a length of time. But most people do not. Okay. Addiction, like all chronic diseases, is easier to treat, more successfully treated, and cheaper to treat, and disrupts your life less the earlier you catch it and the earlier you get help.
Sure.
So if you get help when you first start noticing a problem, very often an outpatient intervention is very successful and works quite well. You don't have to go away, you don't have to interrupt your life really, you can integrate it into your life.
And what is, I guess, the first step? Is that just knowing? Obviously, we always hear recognizing you have a problem.
Oh yes, I mean it is. Now obviously many times it's not the person with the problem who recognizes it, it's the people around them.
Yeah.
Okay. But I would tend to say, generally speaking, people seek help when they notice that it has interfered with their life too much.
Okay.
Okay. And what I would urge people is to say, don't wait. I mean, don't go, it's like, well, I only got one OVI, and it was embarrassing and expensive, but, that wasn't that bad, and I'll wait, I'll probably never get another one. You get another one, it's kind of like, you really should stop now and get some professional help. The thing I get with people is I'll seek help if it gets worse.
Yeah.
And what I'm going is that if you have a progressive and chronic disease, it always gets worse.
And you're almost setting yourself up for that by saying, if it gets worse. I mean, I feel like they're preparing for it to get worse, so why not start now and get help?
Well, yes. Now, what they usually do with the nice denial, which people have heard of, is that they make the unconscious assumption that, well, of course it won't get worse. Okay, I mean, to be fair, this isn't just with addiction, we do it with physical illnesses too.
Yeah.
It's like, I don't want to go see the doctor, my foot's killing me. You do know you're limping more than you think, kind of thing.
And you don't want to be stuck not being able to walk in a week, let's fix it.
And it's like, if you'd have seen the doctor, last year, all right, this would have been a minor procedure. Now you've waited so long, it's going to be a major procedure, and addiction works very similarly.
And Ed, when these people go to outpatient, is this an hour a day, a couple hours a day, weekly? How does the process work?
Well, there are options based upon basically the severity of the addiction. I will say our most common recommendation tends to be what's called intensive outpatient, which is, as the name implies, pretty intensive. It's 3 hours, 3 times a week, either in the morning or in the evening. So it can fit into your schedule depending on what your work schedule is like. You can still go to school, okay, and do treatment. You can still go to work and do treatment. It is still quite a bit of involvement, in your life, but actually, to be quite honest with you, addiction is not easily dealt with, and you do need some fairly high-level involvement in treatment. You just don't necessarily have to go to Arizona.
Right, right. You don't have to disrupt your life and go some oasis that they make it look like.
Yes.
For a long period of time.
Yes. In fact, sometimes most people have heard of detox, for example. Yep. And with the opiate issue being painkillers and heroin being more and more of a problem, not just in Ohio, but across the nation, opiate detox can actually sometimes be accomplished with, say, a 4-day stay in the hospital, and you get on appropriate medication, you get discharged, and you enter an outpatient treatment program. And that works. Okay, so it's almost like if you can manage to wedge a long weekend.
Yeah.
Okay.
Then you're
Then it's you don't have to say, well, I'll have to quit my job. I'll have to do all the things. You do not.
Okay. All right. Well, thank you so much for all the information today. We have the website up. If people need help, then they can reach out to you.
Very good.
All right.